So you heard my first two colleagues, Dave sort of outlined what at least the vision for individualized medicine is. And Jeff talked quite a bit about the kinds of technologies, both current as well as in the future, that we're likely to embark on. And when you look at the technology itself is obviously very useful to us geeks who are in the lab, but there is a real practical benefit that's coming from our knowledge of the sequence of the human genome and its variation. So what I thought I'm going to do is talk to you about a specific sort of medical problem and how we are beginning to look at it and how we are sort of changing our views as to what this clinical entity is, and that's sudden cardiac death. So I'm going to tell you, define clinically what sudden cardiac death is, and it is exactly what the name sounds like. In fact, it's not an infrequent cause of death nowadays, at least a death from a cardiovascular cause. But every now and then, it brings into view somebody that all of us know. It's not just a member of our family or a neighbor or a colleague, but rather somebody that's in national attention. And this is precisely the diagnosis that was given to Tim Russert, when many of you will remember, especially for those of you who live in this town and elsewhere, when he succumbed literally suddenly from a fatal arrhythmic attack. So he's one of numerous, hundreds of thousands of individuals that suffer from this fatally every year, and many other individuals in numbers around the world. But this is what sudden cardiac death is. As in many other parts of medicine, it's some kind of an empirical definition that tries to capture the clinical entity as it gains prominence, that I'll come to. So cardiac death or cardiac arrest is, or cardiac death is cardiac arrest that's precipitated by death, a very short period of time. There is a precise definition of an hour, but clearly that varies. And this needs to be documented in a whole variety of ways. And what the first definition does is sort of beg the question, what else did this individual have? That is, did this individual have other known cardiovascular risk factors? And this definition comes into view only when those are missing. As you can imagine, most of these deaths are unwitnessed. Tim Russert's case was not, but the vast majority of these are unwitnessed. In fact, they occur quite rapidly, and the vast majority of them occur outside the hospital. So clinically, trying to understand the nature of the medical phenotype has been difficult. But the reason why it's gained prominence is, even though medical intervention and public health interventions of various sorts has decreased cardiovascular or coronary artery disease mortality, which is the graph on the left, it's really remarkable as to how much has changed over the last 25, 30 years. That sudden death, which, by the way, wasn't even epidemiologically studied or counted for a long period of time, which is why the time periods differ, that rates of sudden death, in fact, haven't really changed very much, which means that all of the interventions that we have may be good for many other kinds of cardiovascular disease, but in fact, we don't quite understand what precipitates sudden death, and therefore we don't know the cause, and therefore intervention becomes very, very difficult. So this was the basis, and in fact, this occurred after 4 colleagues of ours in Hopkins died within a period of 1 year, that a number of departments within Hopkins began focusing on trying to better understand sudden cardiac death in a variety of ways. First, by improving real-time imaging of patients and the heart. The second is doing genomic studies that I'm going to give you a progress report on. And the third is to sort of combine both of those kinds of knowledge to perhaps do much more cardiac stem cell studies, so that in the future we could perhaps help these patients much more directly. First detect, using genetic methods as to who's at risk, and secondly, do better improved intervention. Sudden cardiac death has, in all likelihood, many, many causes, but the one that we chiefly recognize and probably can sink our teeth into in studies are the result of a number of cardiac arrhythmias. I'm sure all of you know that we think of the heart as the site for a particular kind of human emotion, but of course it's a much more complicated, or in your, or maybe even more boring organ. In fact, it's a pump, but beyond being a pump, in fact, it carries with it remarkably its own electrical system. And what this system really does is to control the rate and rhythm of the heart. And that's the heartbeat. These signals, as I'm going to show you in the next slides, emanate from a specific structure in the heart. It's called the SA node. And in fact, these signals emanate about 60 to 100 times a minute, which is essentially what our heartbeats are. They travel through very specific pathways, or highways, if you will, and structures in the heart. And this electrical signal is what's translated into contractions that allow the heart to pump in a very regular way. So arrhythmias are defined as irregularities in the rate and the rhythm of the heartbeat, and they can be either too fast or they can be too slow, and clearly they can also be quite irregular. I'm sure that most of us, in fact most individuals, probably have had at least one little minor episode of some arrhythmia, and in fact in the vast majority of cases, in most individuals, these are harmless. But many, in fact, are clinically very significant, and they lead to disorders that you might have heard of, such as atrial fibrillation, but sudden death is the other one that we're going to focus on today. So, so that's the structure of the heart. What I told you about is a little bit of the structure at which, they emanate, and those yellow, marked in yellow, are the pathways through which these signals propagate, and they contract the heart so that the blood can be pumped. Now, this, I should say, the performance of the electrical part of the heart can be measured. In fact, it's routinely measured and has been in all of you, I'm sure, as well as myself, through the EKG or the ECG. And the ECG, which in fact involves, as any of you know, they put many leads on us using these very nasty sticky things, which are, they are measured for many minutes. And in fact, you find a rhythmic pattern, and in fact, as a prototype, or I should say as an exemplar, each heartbeat is supposed to have some landmarks, and those landmarks are named. And one of the things that's measured that's relevant to sudden death is the time it takes to go from one particular landmark, for example, right before the Q part of the wave, to the end of the T part of the wave, and that interval is called the QT interval. And nowadays, this QT interval, of course, from a heartbeat can be measured. It can be measured and has been measured in millions of individuals. It can be done in an automated way. And so we can find in each of us a very characteristic QT interval. We can find whether it varies or not. In fact, it's in that variation we find information as to who might or might not be prone to a number of cardiac disorders. So we began the study in looking at that cause of sudden death, and in measurement of the QT interval. In fact, it's got a specific cardiac physiology behind it that we now understand. It's the way in which the electrical current is depolarized and repolarized.